Hi, welcome back to Top 10 Questions. I'm Dr. Harini and we're here with Dr. Diptarka Bhattacharyya. Today we'll be discussing a very important topic on sleep apnea and snoring. So let's jump into our first question. What is sleep apnea?
Okay, so Harini, one of the ways that I explain sleep apnea to my patients is forget all the fancy things. Think of it like drinking milkshake with a straw. Okay, now if you think back to milkshakes with straws, there are two problems that can happen. If you've been given a straw, like those red colored narrow plastic straws that they give in the roadside juice shops, and you try to suck on it, the straws are made of plastic and they're very thin. So you suck really hard, but you can't get the milkshake to come through it. Why? Because it's so narrow that you have to suck really hard, and you're sucking so hard that you're making the straw collapse. The second thing that can happen is what happens in fancy cafes. They give us these paper straws, right? And they're big, thick, wide straws, and they work perfectly fine for the first 10 minutes. But after that, what happens?
Collapses.
Right, they get wet, right? So they get wet and they collapse. So that means that the straw can be too thin or it can be big but floppy. And that is exactly what sleep apnea is. The milkshake here is oxygen, and the straw is your breathing pipe. So if you look at your breathing pipe, the breathing pipe is made up of the top part of the breathing pipe is made up of two parts, the nose and the mouth. The nose is 2/3 and the mouth is 1/3. So you can have a blockage in this nose which can cause 2/3 of the breathing passage to be gone. So now your straw is effectively a very narrow straw. And because you're trying to get air in through such a narrow straw, you're sucking very hard. Because you're trying to breathe in hard, you're collapsing your throat. The second thing that can happen is that the pipes are completely open, but this area in the end where the throat is made of muscles and soft tissue, this area is very loose and floppy, and even with normal suction, this area is collapsing. So irrespective of which one it is, as the throat collapses, you can't breathe. So you are breathing against a very narrow space. So you start creating a lot of snoring and sounds until eventually you completely choke yourself and your breathing stops, your oxygen drops, you wake up, and the entire process starts up again. So that is sleep apnea, and it is one of the most common problems that we see in urban youth in today's day.
How do I know if I have sleep apnea?
Alright, so in the US and in other countries, resident doctors are trained to identify anatomic things that can make you suspicious of sleep apnea. The primary reason for that is many people with sleep apnea find it very hard to know they have sleep apnea. And the first time they figure out they have sleep apnea is after a major heart attack. And the reason these heart attacks happen is because it's like every night in your sleep you're being choked. So as you get choked, your oxygen falls and your heart is still pumping. So as your heart is pumping, it runs out of oxygen and it starts rebelling, and that's when we have arrhythmias or we can have heart attacks. So the fundamental ways that you should know if you are having sleep apnea is A, you snore very, very loudly. Now, not only do you snore loudly, your snoring ramps up and then you stop breathing. Your snoring ramps up, then you stop breathing. Take a listen to this audio clip right here. Now that you've heard it, you can clearly see the sound is going up and then it stops. It goes up and then it stops. Contrast this to this sound clip, which is of my uncle sleeping. Hopefully he does not see this video. Now, in this you can see it is loud snoring, but it is very, very regular. This is the kind of snoring you will see in your grandfathers and older people, and this is not at all risky. So if your snoring is something that gets loud and then you stop, that is a very important thing that should clue you in that you may have sleep apnea. The other things are, you may be gaining weight very fast. And people think, oh, I'm getting sleep apnea because I'm gaining weight. It may be, but it may be the other way around also. It may be that you have sleep apnea and that is why you're gaining weight. Okay? Because sleep apnea increases stress, and stress makes you pile on weight. So if you find that you're eating less but you're still putting on weight, or you can't seem to lose the weight that you've gained, that may be sleep apnea. You may also have tiredness, fatigue, headaches, difficulty in focusing on work, mood irritabilities, depression, feeling low and down all the time, difficulties in sexual performance. All of these issues can clue you in that it is not simple snoring, because simple snoring is physiological. It should not be causing you any of these issues. If these issues start, then you need to think about whether you can be a sleep apnea person.
How dangerous is sleep apnea?
So sleep apnea, the reason why sleep apnea is being talked about so much is it is extremely dangerous for people who have it. The fundamental reasons for that is that it is one of the most common causes for sudden cardiac deaths in young people. Because one of the biggest things that people make a mistake on is they think that only huge, obese, extremely oversized people can get sleep apnea, and that is absolutely wrong. Young, healthy people can also get sleep apnea. If your nose is blocked by, say, a bone that has bent, you can be a normal person with sleep apnea. So do not make the mistake of thinking that sleep apnea is something that happens only to very, very obese people like Bappi Lahiri. It can happen to people who are extremely thin, extremely normally built people also. And these people often don't find out that they have this issue until they've got a heart attack. So sleep apnea on an acute way, it can lead to heart attacks, it can lead to strokes. On a long term, because of the excessive stress that is happening, it will break your body down. So if you don't have one of these major life-threatening issues, you're almost guaranteed to get diabetes, metabolic syndrome, high blood pressure, high cholesterol, kidney issues, heart issues, and many other different physiologic problems. So finding a sleep apnea person and being able to treat them is an extremely rewarding thing, because you take this person whose life is probably going to be a misery after a few years, and you've basically been able to return that person to a long and healthy life.
How can we treat it?
So the fundamental question about treating it is to understand what is the problem. If you look it up, there are things like, oh, sleep apnea, you use a CPAP machine, or sleep apnea, you go for a surgery. So it's not like that. It is really based on what the problem is. Now, if you are someone who's come to my clinic with a floppy tissue problem, then I'm not going to go for a surgical route, because at that point we are using a CPAP machine or a machine to hold these floppy tissues open. But you have to understand that there are two limitations to the CPAP machine. One is that it is not a cure. It is only a control. So once you've put somebody on CPAP, they have to be willing to use it for the rest of their life. The other problem with CPAP is that CPAP is not magic. It just reads the resistance and increases the airway pressure. So if my problem is a bone that has bent and is blocking the airway, my CPAP is going to keep increasing the pressure to make it open, but it won't be able to. So many times people whose problem is a bone that is bent in the nose or an obstructive issue, they will feel that there's too much air that is blowing. They won't be able to use CPAP comfortably, and oftentimes they will stop using the CPAP. Some of these people can also get nosebleeds, and that's not a great way to get long-term results. So these people, a surgical option becomes a very rewarding thing, because a surgical option is the only option that can be a permanent cure from sleep apnea, as long as the patient and the doctor work as a team.
Is CPAP better or surgery?
This is a very common question that we get, and like I just explained, there's no question of better. It's just different tools in our toolkit. we need to be able to use it for different people. So I'm going to give you 3 situations. A young 30-year-old guy comes to our clinic who has just developed sleep apnea, and we look inside, his bone is completely bent and his nose is completely messed up. That person will be a great candidate for surgery because he needs a surgery to fix this, which is 100% going to cure him for the rest of his life. Now, on the other hand, think about a 60-year-old lady who has come to us with sleep apnea, who already has diabetes, already has hypertension. Which one are we going to choose for her? We're going to go for the CPAP. Cut to somebody else who is a young guy who has no obstruction in the nose but has developed hypothyroidism and has gained 20 kgs. What am I going to choose? I'm going to choose the CPAP, because if the CPAP and starting medicines for thyroidism has a chance to get this patient back to normal and avoid a surgery, well, that's fantastic. But if the problem is that there's a physical blockage, then CPAP is not a great tool. So it's not based on which one is ideal, it's based on the patient's problem, and it needs to be decided on a case-per-case basis.
Is surgery 100% successful?
So, in sleep apnea surgery, Harini, you have seen us do this many times. Sleep apnea surgeries are somewhere where before surgery, you have to spend at least half an hour to 45 minutes with your patients, because this surgery is a teamwork. Okay, this is not a surgery where patients come in, I do the surgery, they leave, our relationship is over. That's not what happens. Because what am I doing as a doctor? We are opening up the anatomy of the airway. So we are fixing the bone, we are tightening the floppy tissues, all that stuff. But if the patient does not change to a healthy habit and starts piling up 15 kgs of weight, remember, these tissues are soft. It's like a carpet on which you're putting bricks. Even if I've tightened it out, if you keep loading weight on it, at a certain point of time, it is going to give way. So in these situations, we have to talk to the patient that after the surgery is done, I can open the anatomical pathway for you, but you need to do your part. You need to change your lifestyle into a healthy lifestyle, some workouts. It doesn't need to be crazy, but some workout, some dietary changes so that you can maintain a healthy weight plus and minus. The other key thing is that the first 3 months after surgery is a very important time, because once you've done the surgery and the sleep apnea is fixed, all the stress in your body is relieved. So the stress hormones go down. Now your body wants to lose all the extra fat that it has piled on. So at this time, if your patient starts dieting and exercising, the fat is just going to melt away so fast that it seems like magic, but it is not. So these discussions are very important pre-surgery so that your patient can get great results.
A very common question is how to exercise as a sleep apnea patient.
Okay, so this is a very good question. Now, one of the fundamental problems with sleep apnea is that you have gained and piled on a lot of weight. So we need to focus on exercise that is not going to be heavy on your knees or your joints, and that is going to burn calories. So the best exercise for someone who has sleep apnea is swimming, because swimming protects your joints and it is one of the most high resistance exercises that you can do. If people don't know swimming, we recommend something called as water walking, wherein you walk inside the water, which also protects your joints but gives you high resistance. The other things that you can do are cardio, but low impact cardio. That means no running. As we were talking about it, you don't want to run on treadmills, but you want to walk at a higher incline with high resistance. The idea is to protect your joints while you work on this. The other best thing that you can do for your body is to lift some weights. It does not need to be heavy weights. Light weights will do the job. So using resistance bands at home, using lower weights but higher repetitions are a great way to not only burn calorie but to increase the amount of muscle. Remember, one of the big problems with sleep apnea, which is very frequently forgotten by people, is that the stress and the cortisol makes you lose your muscle mass. So when you lift some weights or you do some resistance exercise like pulling bands, that improves the muscle mass. And as your muscle mass increases, it increases your basal metabolism rate. As the basal metabolism rate increases, even throughout the day, even when you're sitting or sleeping or working, if your BMR is higher, you're burning more and more calories. So usually this requires working with a trainer or a fitness coach who will guide on this. We do have our own fitness coaches who work with our patients to give them a customized treatment plan and a workout plan, but you can also use app-based services. You can go to a local gym and find a certified trainer, and they should be able to help you get a proper workout plan in progress.
How can we prevent sleep apnea?
So the fundamental problem with this is that you cannot. There are some people who are going to get sleep apnea just because of the way their bone has bent. Some of them are going to get sleep apnea just because of the way your anatomy is. You cannot change it. But the best way to prevent sleep apnea, the preventable cases of sleep apnea, is of course to keep a healthy lifestyle. So do some workouts. Even if you're busy, get to the gym maybe 3 or 4 days a week. Watch out for your diet. Absolutely cut down smoking, cut down stress. Do some amount of meditation or box breathing that improves your biomechanical feedbacks. These are all very helpful tools. Another thing that we normally talk about is people underestimate the role of stress, depression and smoking with sleep apnea. So all of these things can further cause you to increase the cortisol, which can cause the first piling up of weight, which then gets you sleep apnea, which sets the whole cycle in motion. So the best way to stop or prevent yourself from getting sleep apnea: give up smoking, healthy lifestyle, limited alcohol, work out a little bit, meditate, give yourself breaks, give yourself good sleep, and those are the best things that you can do for your health. If you're gonna get it in spite of that, well, there's nothing really much you can do about it. You need it treated.
Can sleep apnea recur after surgery?
100%. So that's exactly what we were talking about all this time. That once we have treated a sleep apnea, it could be by a surgery, it could be by CPAP with exercise, whatever way. Once we have treated it, we tell our patients that at 3 months after sleep apnea, your body will stabilize at a certain weight. That could be 90, 80, it doesn't matter. Now, once it is stabilized to that weight, that is your base weight. Now, for the rest of your life, you need to fluctuate between 5 kgs over to 5 kgs under. Look, we have to be realistic. If I tell you that you have to eat salads every day, you're not going to be able to do it. So we don't want anything radical. You need to make changes that are sustainable. That means add a little bit of vegetables in your diet, okay? Reduce alcohol to once a week. Small changes. If your weight is going up from 90 to 93, you need to recognize that and you need to start working out a little harder to bring it back to 90. So usually, as long as you are focused on that, your weight should fluctuate between plus 10%, minus 10%. If that happens, plus 5, minus 5, then you're usually not going to see a recurrence of the sleep apnea until a certain age of 70, 75, after which it is very hard to predict how our bodies will react. But if your weight changes, you have, for some reason, someone goes into depression, they're drinking like crazy, they pile on 20 kgs of weight. Irrespective of what surgery has been done, if you keep piling weight above 15-20 kgs, you can 100% get a recurrence of sleep apnea. So it is a two-way street. The doctor can fix the anatomy, but you have to work to making it work for long term.
Is all snoring sleep apnea?
No, absolutely not. There are two different kinds of snoring. The normal snoring is loud, it can be very annoying, and about 35 to 40% of patients who come to our clinic for snoring are actually brought in by their spouses because they can't sleep in the room. It affects their conjugal life, it affects their personal life, and these patients often look for cures for snoring. But once you've figured out it is not sleep apnea, then the basic importance is that whereas with sleep apnea, I need to go maximal because I need to fix it, because otherwise this is going to be a major health issue. With snoring, we start from the most minimal thing that we can do, because this is really a lifestyle issue. This is really something where you want to solve the problem that that particular patient or his family are having. So while there are multiple options, clinical options, medicines, small injections, small in-clinic procedures, small surgeries, different options are there. This is really like a step ladder approach. So we'll always start with the most basic steps, and then we have different things. In this, we sometimes work with stiffening of the palate. We start with tightening up certain areas, injecting certain spaces, putting fat in certain spaces actually to make those areas dampen up and not vibrate. There are about 20 different things that can be done based on the problem. But again, that is really a minimalistic approach compared to sleep apnea, where it is a more maximal approach.
That was our 10 questions.
So this was a great talk. Thank you, Harini, and thank you for joining us. We'll see you soon with another episode of Top 10 Questions. I'm Dr. Diptarka Bhattacharya. This is Dr. Harini, and we are DrBhattacharyyaENT. Take care. See you soon.